Hello, I'm Holly. I have the privilege of being the manager of the NPDA. Thank you so much for coming today. It's just a really nice opportunity for us to put a name to an email address in so many instances. So thanks for joining us. It's always quite nerve-wracking hosting a conference. This is the second one that we've done. And we really enjoyed the first one, and the statistic from the feedback that we were most proud of was that 99% of those surveyed said that they were going to leave the conference with an idea for an improvement in their own service. So that's our benchmark for success for this event. So I do hope you take something away, a little, even if it's something small, a little bit of inspiration of something that you could do in your service. And I'd also like to take the opportunity to thank the speakers who are hopefully going to provide those examples of inspiration. All the speakers that you're going to hear from today volunteered, apart from Lena, who we invited from Sweden. Thanks to Lena for coming over, braving the storms in Amsterdam to get here today. So yeah, just thanks. And I'm just going to have 5 minutes now in advance of Justin's presentation to tell you a little bit about what we've been up to in the last year and what our plans are for 2018. So I hadn't quite appreciated until I wrote this slide how much we've done since we last saw you at the conference in January in 2017. And the most important achievement was winning the new contract to deliver the NPDA. So the NPDA is going to run until 2020 with an option for 2 years extension after that, possibly. So that was a relief, I can tell you. We've also welcomed some new staff members. We've said goodbye to NPDA, and we've got Cynthia and Katie in the corner. Can you wave, please, so people can see you? Welcome, Cynthia and Katie. There were so many people wanted to come that we've relegated ourselves to the back, so you can all sit down. So if you need to speak to anyone from the college, they're lurking over there. And we commenced development of the RCPCH Diabetes QI programme that you're going to be hearing from in a little bit from Kasia and Sue. We had some underspend through excellent financial management in the previous year's contract that HQIP have kindly allowed us to spend on QI activities within the college. So thank you, HQIP. We launched NPDA Results Online, which I really hope you've had a look at. That's the web tool we've got, so you can look at your unit's results and compare them to other units in your region or nationally. We've published the 2015-16 national report and an admissions report. That was a huge piece of work, linking data that we collected admissions data from the NPDA and linking that to HES and PEDI data on admissions, and some really interesting findings came out of that, so I hope you saw that one. And we also supported NHS Digital, the adult audit, to produce the National Diabetes Transitions Report. We developed and launched 2 new data collection platforms, which I hope you agree are an improvement on the previous ones. We really like the summary reporting. And a lot of work has gone into packing those with algorithms to give you that summary reporting, so I really do hope you find them useful. We also hosted a data entry workshop to support staff to enter data into the new data entry platform to try and make it easier for you, but also to increase the quality of the data that we're collecting. We've begun the redevelopment of the new NPDA PREM surveys. We worked with NHS England and HQIP to deliver, but not yet launch, and Justin, I think, is going to touch on that in his speech, the Paediatric Diabetes CSQM. You've probably got some opinions on that, and maybe we can talk about that at lunch. But yeah, Justin can cover that. Okay. We've also worked with the best practice tariff team in England to ensure that any items included in the tariff that are going to be based on audit data makes sense. Justin's also going to tell you a little bit about the international studies that we've contributed audit data for. And we have worked with the National Screening Programme to try and improve access to retinopathy screening data to units. So yeah, it's been a busy year, but a good one, a really good one. So a lot still to do though. So we're currently collecting the new 2017-18 data set that covers the audit year from March last year to April this year, and units will have an extra couple of months to finalise submissions after April. We're also frantically writing up last year's results. We're submitting the draft to our funders, HQIP, the week after next, yes, and that is due for publication in April. We're then going to be updating NPDA results online with that unit level data, with some preview data sent to you in advance so you can check it out. We are also doing 2 spotlight audits this year. As part of the new contract, we were asked to look at 2 areas of interest to diabetes units in terms of supporting quality improvement. So at the last conference, we asked you what we should be auditing, what would be interesting to know at national level. And it was decided that we should look at the workforce subsequent to a study that UCL did in the paediatric diabetes workforce, and also look at access to pump and insulin technologies and results associated with those. So that's what we're going to be doing. It's going to be service level. You'll barely notice it. Short surveys, very small audit burden, don't worry, but it's going to produce some really interesting data that we can then cross-reference with the outcome data that we collect. So we're quite excited about those. We're also going to be piloting the PREM in the spring, and working with Diabetes UK to support the national network meetings to ensure their sustainability, and also to just get more feedback from parents. We try and make the outputs from the audit relevant to yourselves and also to parent and patient groups. So we're just checking in that we're doing the right thing with parents and getting new ideas from Diabetes UK. So thank you for listening.